Hello, my name is Logan McAlishan. I'm a physical therapy student at the University of Saskatchewan, and this video is going to detail some of the anatomy, arthrokinematics, and the osteokinematics of the upper cervical spine, or the occiput acting upon C1 and C2. For anatomy, we have the occiput, which is part of the skull, sitting atop C1, also known as the atlas, sitting atop C2, also known as the axis. There are some unique features to the joints between these, namely that there are no intervertebral discs, as there are with the other parts of the cervical, lumbar, and thoracic spine, and there are no intervertebral foramen. It should be mentioned that the joint surface of the occiput on the atlas is convex, so the occiput's convex, the atlas is concave, and then between C1 and C2, both of these joint surfaces here are convex, which is going to play a role in the biomechanics later. In terms of supporting ligaments, it should be noted that there's the tectoral membrane up top, the apical ligament, the posterior and the anterior atlanto-occipital membrane, the atlantoaxial membrane, the cruciform ligament, and the alar ligament. That last one, the alar ligament, is particularly important because it plays a role in the coupling motion between side flexion and rotation that will be demonstrated in just a moment. The first joint I'm going to talk about is the atlanto-occipital joint. This joint has 2 degrees of freedom. You can either move in flexion and extension, or you can also have some small side flexion with this joint. In terms of flexion and extension, both have the same axis of rotation, and it both occurs in the same plane. The axis of rotation is through the external acoustic meatus, or also through the ear canal, and it occurs about the sagittal plane. During flexion, the skull rocks anteriorly, and the occipital condyles slide posteriorly. So the opposite occurs during extension at this joint. So the occipital condyles of the occiput slide anteriorly, and the skull rocks posteriorly. The second motion that can occur at this joint is side flexion. Side flexion has an axis of rotation that's anterior-posterior going through the nose, about the coronal plane, and the rotation axis of motion is a vertical one that goes through the foramen magnum. You might be wondering why I also added rotation in there as well, and it's because at this joint, side flexion is a coupled motion. So every time you get side flexion, you also get some rotation as well. So when side flexion occurs at this joint, at the atlanto-occipital joint, there's a slight bit of rotation in the opposite direction that happens at the same time. So arthrokinematically, when the occipital condyles translate in the opposite direction to the side flexion. So for example, when you're looking towards your right shoulder, in this case I'm looking this way, the left occipital condyle slides anteriorly and the right occipital condyle slides posteriorly. So to better understand the coupling motion between side flexion and rotation at the atlanto-occipital joint during side flexion, I'm going to put you up at this angle. So as I said before, there is a coupling motion. So as an example, when you're looking towards your right shoulder during side flexion, the left occipital condyle will slide anteriorly and the right occipital condyle will slide posteriorly upon the atlas. So when I tilt to my right, there's a slight shift. So at the atlantoaxial joint, it also has 2 degrees of freedom. You have flexion and extension, and then you also have side flexion coupled with rotation. I'm just going to demonstrate again over my shoulder just because it's easier to get a sense of posterior, anterior, lateral, superior, inferior, etc. with these demonstrations.
So flexion and extension at the atlantoaxial joint occur about a transverse axis that goes through the osteoligamentous ring in the sagittal plane. And because the joint surface between the atlas and the axis is biconcave, it's like each facet is essentially like a dome touching another dome. So during flexion, the joint, the superior joint, or the atlas, slides anteriorly and inferiorly, and during extension, slides posteriorly and inferiorly. Side flexion at this joint occurs about an anterior-posterior axis through the nose in the coronal plane. So when side flexion occurs, what you'll end up having is the alar ligament tightens on C2, causing rotation to that same direction. C1 then proceeds to translate the same way, but rotate the opposite. So, as an example, when right side flexion occurs, the alar ligament tightens, causing C2 to rotate that same direction. This makes C1 rotate the opposite direction and slide towards the side of rotation. When rotation happens at the atlantoaxial joint, it happens about a vertical axis going through the dens. So when rotation occurs at the joint, again, remember it's a coupled movement with side flexion. So the C1 facet on the side of rotation slides posteriorly. The facet on this opposite side will slide anteriorly, and then you'll also get a translation of C1 to the contralateral side of rotation and side flexion. So putting this all together as an example, when the skull rotates to the left, so we have my C1 and my C2, you'll have left rotation of C1 with my left facet moving posteriorly, my right facet moving anteriorly, along with a right translation and a right side flexion, all happening at the same time.
Thank you again for watching my video on the biomechanics and anatomy of the upper C-spine. If you have any questions about the motions or any of the material discussed in this video, please do feel free to contact me and we can talk further.